How can we vaccinate the world? Since the outbreak of the COVID-19 pandemic, there has been a significant number of infected cases and deaths. This has imposed a huge burden on the healthcare system due to the increasing number of hospitalizations and medical expenditure. Despite many COVID-related cases and deaths, vaccination rates remain insufficient to achieve herd immunity, even in high-income countries. The variation in vaccine acceptance around the world is illustrated in this diagram, and we can see that the acceptance of vaccines is unsatisfactory, especially in places like Japan and Libya. So we have identified 5 key areas of concerns that are hindering vaccine uptake. First, social media and the rapid spread of misinformation. Second, people's lack of urgency or incentives to get vaccinated. Third, disparity in vaccine supply and distribution between countries. Fourth, concerns with infrastructure and logistics when delivering vaccines. Last but not least, lack of trust in the healthcare system, particularly among diverse communities. Strategies to address these concerns will be important to vaccinate the whole world.
To increase vaccine uptake, the WHO could recommend that governments improve how they regulate and communicate about vaccines on social media. Anti-vaccination myths spread quickly due to psychic numbing, when emotive language and first-person narratives evoke an empathetic reaction. In contrast, governments and healthcare organizations generally use technical scientific jargon. This phenomenon is why anti-vaccination tweets are retweeted 4.13 times more on average than neutral tweets. In the UK, improving online scientific communication and removing false information contributed to the fall in vaccine hesitancy from 39% to 11%, as seen in this graph. This effect could be transferable to other countries where social media is popular.
The vaccine passport can be used to highlight urgency. It would contain all information related to vaccination status, which can be used to regulate people's movement and privileges, such as international travel and lockdowns. People may be more encouraged to get vaccinated if they can have a quality of life similar to pre-COVID times. Specific behavior goals can be achieved by offering incentives such as food vouchers, gift card, or lottery prizes. Vaccine lottery is associated with an increase in vaccination and is widely used. Ohio has introduced a COVID-19 financial lottery, leading to an increase in vaccination rates. Evidence shows that financial incentives may decrease vaccine hesitancy among minority groups, improving vaccine equity.
Getting every country the right number of vaccines is essential to vaccinate the world. The WHO has advised on international supply logistics like labeling and traceability standards, but more can be done. South Africa and India have proposed relaxing intellectual property rules to lower vaccine production costs and ease tight restrictions that impede vaccine accessibility. Likewise, removing trade barriers would improve the redistribution of existing supplies, which is currently being done through slow individual negotiations. New trade agreements could address the pandemic-specific urgency and need for vaccine equality using market forces. With political willpower, these changes could improve vaccine supply worldwide.
To alleviate limitations of the physical vaccination process due to infrastructure, some countries, such as the UK, have implemented a drive-through service model. This allows an end-to-end vaccination process while in a vehicle, minimizing the spread of COVID-19 and reducing the need for many of the resources a regular vaccination center would require. To optimize booking system logistics, South Korea has introduced a strategy in which locals are notified if any vaccines are available at the end of the day due to vaccine no-shows. Those notified can accept the invitation and be vaccinated immediately by heading to the center. This action promotes vaccine uptake, but also minimizes precious vaccination wastage.
A major factor for vaccine hesitancy is the trust which the public have in their health system. Would you heed advice when you have little confidence in the personal source from whom it is coming? Trust in the healthcare system can be fostered almost through leading by example. Doctors and other healthcare workers should not only be the first to be vaccinated because they are frontline workers, but because they are the ones whom we all look to for advice. How trust in the healthcare system is perceived depends as well on your socio-cultural or socio-economic background. We are not safe until we are all safe. Having representatives from diverse communities to champion vaccine uptake can foster trust in these communities too.
Vaccination is an important step to curb the devastation caused by COVID-19. The spread of misinformation through social media, lack of urgency among recipients, limitations in supply, and delivery logistics have impacted vaccine uptake. Diverse communities are uniquely impacted by each of these factors. Strategies designed to address these issues can have a huge impact and could be used to vaccinate the world.